A deadly drug-resistant superbug is spreading rapidly in the United States, with a staggering 2,000 cases reported in a single state, according to health officials. Candida auris, or C. auris, has been classified as an urgent threat by the Centers for Disease Control and Prevention (CDC) due to its high transmissibility, severe health consequences, and growing resistance to treatment. The infection primarily affects hospital patients and those with weakened immune systems, often leading to life-threatening complications. The CDC warns that C. auris is fatal in up to 60% of cases, making it one of the most dangerous emerging pathogens in the country. Unlike common fungal infections, C. auris is particularly alarming because it does not always present immediate symptoms, making detection difficult. While some individuals may experience mild effects such as fever, chills, low blood pressure, or rashes, the infection can quickly escalate into bloodstream, wound, and ear infections, which are significantly harder to treat. The superbug has shown an alarming ability to spread within healthcare facilities, where vulnerable patients, many of whom are already battling serious conditions, are at the highest risk. Compounding the crisis is the fungus's resistance to multiple antifungal medications, leaving doctors with limited treatment options. Since its emergence in the United States, C. auris has continued to spread at an increasing rate. Between 2016 and 2023, the country recorded 10,788 confirmed cases, with New York leading in reported infections, accounting for nearly 1,800 cases during that period. The rapid acceleration of cases in 2025 suggests that the outbreak is far from contained, and current prevention efforts may be falling short. The CDC's warning highlights the urgency of implementing stricter infection control measures, particularly in hospitals and nursing homes, where the pathogen has been most prevalent. The rise of drug-resistant infections like C. auris presents a growing threat to modern medicine. Infections that were once treatable with standard antifungal drugs are becoming increasingly difficult, if not impossible, to cure. This crisis is part of a broader trend in antimicrobial resistance, which the World Health Organization has identified as one of the greatest public health threats of the 21st century. If resistance continues to grow at its current pace, common infections and medical procedures could become significantly more dangerous, potentially leading to a scenario where routine surgeries and hospital stays carry an unacceptably high risk of deadly infections. Adding to the challenge, C. auris has proven difficult to detect and eradicate. Standard laboratory tests may misidentify the fungus as a less harmful species, leading to delays in treatment and increased chances of spreading the infection. Furthermore, the pathogen is known to persist on surfaces for extended periods, making decontamination efforts especially challenging. Healthcare facilities must take extreme precautions, including enhanced screening, improved sterilization protocols, and strict isolation of infected patients. Without immediate and aggressive action, the superbug could continue its alarming spread, placing more lives at risk. The implications of this outbreak extend beyond hospitals and into broader public health concerns. While C. auris primarily affects those who are already ill, its ability to survive on skin and surfaces for weeks means that it could potentially spread into communities, further complicating containment efforts. The rise of antibiotic and antifungal-resistant pathogens is no longer a distant threat. It is an active crisis unfolding now. If new treatments are not developed and infection control measures are not significantly strengthened, the world could face an era where once manageable infections become life-threatening again. Although researchers are racing to find new antifungal treatments, progress has been slow, and the pipeline for novel medications remains limited. The pharmaceutical industry has largely focused on developing antibiotics rather than antifungals, leaving a dangerous gap in the fight against deadly fungal infections. Governments and research institutions must prioritize funding for antifungal drug development to prevent C. auris and similar pathogens from gaining an even stronger foothold. For now, the best defense remains vigilance. Healthcare facilities must enforce rigorous hygiene practices, screen patients for the fungus, and act swiftly at the first sign of an outbreak. Patients and caregivers should also be informed about the risks, ensuring that any potential symptoms are reported and addressed as quickly as possible. The rapid spread of C. auris serves as a stark warning. Without immediate and sustained intervention, drug-resistant infections could become one of the greatest medical challenges of our time.